Mr. Chair, for allowing me to participate virtually. I've been reading these articles about threats to public health officials, and they're very startling. I just read an article detailing how in Kent County, Michigan, just last month, a public health official whose public health department issued a mask mandate, said that a woman driving more than 70 miles an hour tried to run him off the road twice in one night. He said someone also called him an expletive and then yelled, quote, "I hope someone abuses your kids and forces you to watch." In another incident, this time in Colorado, in Jefferson County, Colorado, someone threw live fireworks into a tent of public health workers administering vaccines. And then in Ohio, someone actually went up to a former public health official's home and shot into their home in a suburb that's not otherwise known for gun violence. Dr. McKenney, let me start with you for a moment. You've seen this backlash and you've talked about it a little bit. I also saw that you told NBC News that it might have something to do with your race. Can you talk to us a little bit about that? As an Asian American, I'd be curious about your observations there.
Yes, thank you so much for asking. I do believe that there is a lot more that has to do with race within the pandemic that we haven't talked about. And that might be the hate against Asians that we've seen out there. It also might be the discrepancies in the care that people have gotten because of their various races or socioeconomic status. So there is so much more to it, I think, than we have really even than we've been able to dive into at this point. As a Filipino American woman in a small town in Kansas, you can imagine I'm not exactly what everybody looks like here. My benefit is that I've grown up here, so they know me and I've built trust over the years. But even with that, you still hear the comments about how this was, this is an Asian or a Chinese disease, and you feel the fingers being pointed. There's no denying that there has been racial issues throughout this entire pandemic. And it's so unfortunate because, again, that is not what we're trying to fight. We don't need to be fighting each other. We need to be fighting this virus. And somewhere along the way, people decided that...
Can I jump in for a second?
Yeah, please.
Did any officials or public figures exacerbate that particular situation for you in the way that they talked about the public health threat?
I did not personally have anyone that was an elected official say that directly to me.
Okay. Let me just, I think that this is something that we have to tamp down, which is anti-Asian American bias and, of course, anti-Asian hate crimes. And unfortunately, it's manifesting itself everywhere, including toward public health officials, where you see a disproportionate number of people of Asian American heritage represented. Dr. Cantor, I understand that you recently spoke at an assembly where you were talking about the efficacy of mask wearing, and somebody said you were, quote, complicit in genocide for making people take these vaccines. So I guess you also talked about the effectiveness of vaccines. How dangerous is it when people believe that public health officials such as yourself are complicit in quote unquote genocide?
Thanks. I appreciate the question. And as the grandson of Holocaust survivors, that was a particularly stingy comment to make. I just wish people would tone it down. And I think we can have a discussion about what a prudent public health response is. And there's room for that discussion without taking to the level of personal attacks, without even assuming that people are doing things because they're trying to be a tyrant, quote unquote. But there's been a lot of these high level accusations. There's memes with Nazi imagery, and it just needs to be taken down because the things that Dr. McKenney described are real, and people are going to get hurt, and the people that are trying to help people.
Let me just jump in and summarize. I think that the anti-Asian or anti-Semitic tropes that kind of are coursing through social media generally, and in the white supremacist movement are also being directed at public health officials now. And this is deeply dangerous, and we have to combat it wherever it rears its ugly head. Thank you so much.